Hello. Welcome back to our channel. Today we will talk about stomach cramps in pregnancy. This is a common symptom experienced by many expectant mothers and can be caused by a variety of factors. Although stomach cramps can be uncomfortable and sometimes even painful, they are not usually the cause of bad results. In fact, most women experience stomach cramps at some point during their pregnancy. One of the most common causes of stomach cramps during pregnancy is the stretching and enlargement of the uterus. As your baby grows, your uterus expands to accommodate its increased size, which can cause mild to moderate cramping. These types of cramps are usually felt in the lower abdomen and can feel similar to menstrual cramps. You may experience these types of cramps throughout your pregnancy, but they are most common in the first trimester. Another common cause of stomach cramps during pregnancy is constipation. Many women experience constipation during pregnancy due to hormonal changes that affect the digestive system. When stool is hard and difficult to remove, it can cause abdominal discomfort and cramps. To prevent constipation, be sure to eat plenty of fiber-rich foods such as fruits, vegetables, and whole grains. You should also drink plenty of water and stay physically active. Gas and bloating can also cause stomach cramps during pregnancy. This is because the hormone progesterone can slow down digestion, causing gas and bloating. To relieve gas and bloating, try eating smaller, more frequent meals throughout the day, and try to eat less of foods known to cause gas, such as beans and cabbage, during periods when you feel cramps and pain. Dehydration can also cause stomach cramps during pregnancy. Make sure you drink plenty of water throughout the day to avoid dehydration. You should aim to drink at least 8 glasses of water a day and more if you are physically active or if the weather is hot. There are other factors that can contribute to stomach cramps during pregnancy. For example, round ligament pain is another common cause of cramps during pregnancy. This happens when the ligaments that support the uterus stretch and thicken to accommodate your growing baby. Round ligament pain is usually felt on one side of the lower abdomen and can be sharp or stabbing in nature. Another potential cause of stomach cramps during pregnancy is urinary tract infections. May cause cramping, pain or discomfort during urination and an increased need to urinate. If you suspect you have a urinary tract infection, it is important to seek immediate medical attention as untreated patients can lead to complications such as kidney infections. An ectopic pregnancy is another serious condition that can cause stomach cramps during pregnancy. This happens when a fertilized egg implants outside the uterus, usually in one of the fallopian tubes. An ectopic pregnancy can cause severe abdominal pain and cramps, as well as other symptoms such as vaginal bleeding, shoulder pain, and dizziness. If you experience these symptoms, seek medical attention immediately. Premature birth can cause stomach cramps during pregnancy. Preterm labor is when you go into labor before 37 weeks of pregnancy. Symptoms of preterm labor include cramping, back pain, pelvic pressure, vaginal bleeding, and contractions that occur every 10 minutes or more. If you suspect you are experiencing preterm labor, seek medical attention immediately. In conclusion, although stomach cramps are common during pregnancy and are usually not a cause for concern, it is important to be aware of the potential causes and seek medical advice if you experience serious or unusual symptoms. By understanding what can cause stomach cramps during pregnancy and taking steps to manage the discomfort, you can enjoy a healthy and comfortable pregnancy. Thank you for watching us. We wish you a healthy day.